I would like to introduce Philip Molyneux, who's our consultant for a few years now, who is also a member of Imperial. He's the director of the clinical research facility at the Brompton, and he will chair the last session. Phil, over to you.
Thanks, Vasilis. Yeah, so none of those things qualify me to be able to keep this to time because we're obviously already running a little bit late. But I will do my best to get us out of here before we all want some dinner. That being said, the topic here is a research strategist, what's going on in sarcoid, but more to the point, what should we be looking at doing from a patient perspective? What should our priorities be? How can we help patients and how can we drive sarcoid research over the next decade? Because without preempting what's coming, we all know that the sarcoidosis research field is dwarfed really by the pulmonary fibrosis field in general, and idiopathic pulmonary fibrosis, which has got all the attention over the last decade. So without any further ado, I'll hand over first to Professor Athol Wells, who will try and give us an overview of what the Brompton are specifically doing. Thanks, Athol.
I hope you can see my slides. I knew this would be a little time shortened, so all I've done really is set out the three areas that we are both involved with, but might be, and there are just 3 slides. So first of all, understanding what drives sarcoid. And I think we must all continue to pursue whether particular triggers apply to people with a particular genetic makeup, with the trigger then triggering overexcitable macrophages and other pathways. We have in our discussions earlier today separated these possible causes of sarcoid, but I think that exploring genetic predilections and what happens with pathogenesis is terribly important. There is currently a large grant proposal in development in sarcoid with collaboration between the hospital and Imperial College and between the hospital and other basic scientists and translational workers. So that's the first domain. Now, the second one is the area in which we're most advanced, and that's actually trying to work out who in sarcoidosis has danger and trying to do that more accurately. So trying to get a better balance of who can escape without having to have treatment and who you would want to intervene in as early as possible. And I can highlight that Vasilis and Rakesh Sharma have been at the core of developing this in cardiac sarcoid. Firstly, how can we pick it up easily and what is the best balance of routine tests? But also how can we find out as quickly as possible as to who is at risk so that we're not treating too late, but we're not over treating either. Now, I can say that we've developed a staging system using simple lung function in pulmonary disease. It's now very close to completion. It's been validated in 2 major European cohorts, each of over 1,000 patients. And I think we are working towards taking part and hopefully co-leading treatment trials in cardiac sarcoid once we have the best possible working out the best possible stratification of who's at risk and should have earlier treatment. And then finally, I kept this slide and just made it up about half an hour ago because I wanted to pull together all of the questions that were asked. But I'm going to confess now, in my election to what will become the president of WASOG, you had to set your goals. And I have felt quite strongly, but didn't want to say it because it committed me to it, that we need an international patient charter. We need a document that defines what patients have a right to expect from their expert advisors. And I've seen enough today to become entirely convinced that to define a profile of what really matters to sarcoid patients in a very large patient group has got to be the way to shape this. So you've all taken views as to what is missing and what matters. I think to have a UK-wide profile of the impact of sarcoid, you've done great stuff, Sarcoid UK, with actually some of the questions you've asked. But I would really like to see a patient charter built on what really matters to patients. It also seems very clear today that what we need is a better sense of what happens with calcium and vitamin D metabolism. And if we have research into this area, this should then drive expert guidance. And finally, for trials, we have to develop what are called patient-related outcome measures. And Phil, I'm just going to close. I haven't taken, I think, too much time, but think about quality of life. Think about some of the complex questionnaires that are not fitted to particular patients. Now, there is a move in the disorders known as inflammatory myopathy, that when you construct a trial and you're looking at a drug to improve quality of life, you find out in each individual patient what matters to them in their quality of life and what is threatened by their recent experiences. And you actually have individualized endpoints. And I think that in sarcoid, there's going to have to be this sort of approach so that we can really have proper trials of quality of life rather than relying on these complex questionnaires that are very uneven in how they apply to individuals. So for example, some people hugely value exercise. If I had sarcoid though, my attitude would be, I think, that if I ever feel the urge to exercise, I try to lie down until it has passed. And so I think to have those sorts of outcome measures is crucial. That's my lot, I think.
Thanks, Athol. So yeah, I mean, I think that's some very interesting points and areas to look at. When we think about research from sarcoid, you look across the breadth of disease areas we've heard about today, it's unsurprising that big pharma companies have really struggled to tackle this problem, given the different patient types we have and we care for. So we've heard from what Athol thinks and what the Brompton think, but really we're now going to hear what Sarcoidosis UK think from a research strategy. And it's my pleasure to introduce Peter Tickbom from Sarcoidosis UK, who's going to try and give us a brief update in what their upcoming research strategy is. So over to you.
Thank you very much, Phil. And I should be now on screen. Thank you very much. So, yeah, I mean, first of all, I just want to thank Vasilis, the Royal Brompton, and all the other speakers today. It has been an absolutely amazing day. And you know, for Sarcoidosis UK, we've been really pleased to partner in the delivery of this. That's been absolutely fantastic. What I thought as we went through the day, one thing that leapt out of me was something that Dr. Paolo Spagnolo said, which was sarcoidosis is a neglected disease, and that sort of resonated with me in that, you know, and he said how big pharma is engaged with with sarcoidosis, but they sort of need a steer. I think that's sort of when we talked about Sarcoidosis UK, that's perhaps one place in which we fit. And within that, what we've been doing over the last number of years now has been funding what I would call, I don't know what an expert would call it, but sort of seed research. Clinical trials, large-scale clinical trials cost millions of pounds, and obviously developing specific drugs for specific illnesses can be hundreds of millions, billions of pounds, depending on the disease. And I think with something as wide-ranging in terms of effects on individuals, as sarcoidosis, those pharma companies are also looking for a steer. I mean, and that's one of the things that Paolo said. And that's where Sarcoidosis UK has been very effective. We raise money, and with the British Lung Foundation, we partner with them to fund research. And we have funded relatively small-scale trials, both in existing drugs where research tells us that they may make a difference in the way they interact with the body. They may make a difference to sarcoidosis. And of course, we've talked about research into causes of sarcoidosis, whether that be environmental factors or genetic factors. So for us, it's very important that that the experts we've had on today, the researchers, physicians, etc., continue that research, and we're very proud to play a part in raising money year on year to fund those seed studies, as I would call them. The charity has grown very significantly in the last 10 years, for sure. And I think today, the success of the day, the amount of people that have engaged, I've seen peaks of over 600 people watching during the course of the day. We're definitely resonating with people. And I think the fact that we've been able to work together to present this to sarcoidosis sufferers has been absolutely amazing. So, so for us, one important thing out of today is that we are able to continue to fund the research to find a cure. That's one of the things we're here for, apart from supporting people and finding information. So I guess the one last thing I would say before I hand back is, it is important that we raise that money, continue that funding. So for those people who are still on, if they could go to sarcoidosisuk.org/donate and make a donation that continues to fund the research that helps all of the researchers we've had on here today, that would be absolutely fantastic.
Thank you, Peter. Thank you, Phil. Thank you, everyone, for an excellent day. I honestly, I'm really, really happy about everyone's contribution. I want to thank all the external colleagues that attended and stayed until now, the international colleagues, and Filippo particularly, but also all the Brompton group that participated, and I hope that this was informative, and we will take it from here and continue to support the sarcoidosis patients.
I think I'd like to offer a final thank you to you, Vasilis, because I have to say, I think everyone involved in this day has got a huge amount out of it. You've set up a forum where I think the doctors involved have also learned a great deal. And so this is fabulous, I think. So well done indeed.
Thank you, Prof. So I think that we will bring this to a closure. We finally managed to be on time, so that's great. Lots of thanks to Leo, Leo and Charlene, who have really worked with me in the background quite a bit. And we were meeting every week discussing about every issue. So thank you, Leo. Thank you, Charlene. Thank you, Sarcoidosis UK. Bye-bye to everyone.